The first time I was in a surgical room, I fainted 3 times.
Plastic surgery is a combination of science and art.
Most of the surgical procedures we perform can be done in local anesthesia and sedation.
The less we traumatize the tissue, the faster is the recovery.
You always think that it will get a bit better. It doesn't.
Work harder because nothing comes if you don't work hard.
Plastic surgery should make you enhance what you already have.
I think Dubai is
Very big, very different from Switzerland.
what is your vision of plastic surgery?
Natural results.
Dr. Matteo Vigo is a leading plastic surgeon in Dubai with over 20 years of experience in breast augmentation and cosmetic surgeries.
He is also one of the first UAE licensed surgeons to perform Mia Femtech, a minimally invasive breast enhancement procedure that delivers natural results with minimal scarring in less than 15 minutes.
Dr. Matteo Vigo, where precision, expertise, and care come together to create life-changing transformations with natural, lasting results.
Hello everyone and welcome to another episode of Beauty Talks by Dr. Matteo Vigo. As you know, my business is growing. I'm very busy lately, and in the past couple of years, I've seen the number of patients really increasing in my practice. So 1 year ago, I decided to start looking for someone who can help me in this journey, support my profession and my job, and be someone who patient can trust and can rely on another professional figure that I can accompany to myself. So today I'm very happy to introduce this colleague, Dr. Carlotta Barbon.
Hi, good morning.
Good morning. Thank you so much for being here.
Thank you.
Carlotta is a plastic surgeon, and she's Italian like me, but she has a different excursus in her studies, so we will dive into that later on. And she is very happy to have started this journey with me, and she will explain us what is a vision about plastic surgery, what she will do for my team, and I will try to let the patient understand why they can trust her and why I decide to work with her. So let's start immediately and tell us a little bit, who is Carlotta Barbon?
Good morning, and thank you very much for the nice introduction.
My pleasure.
I'm Carlotta Barbon. I was born and raised in Italy. I did my medical school in Italy in an English course at the University of Pavia. Then I moved to Switzerland for my surgical training. I started a general surgery training at first, and then I decided for plastic surgery. So I did part of my training between Switzerland and the United States. I was at the Johns Hopkins Hospital, and then in Switzerland at the University Hospital of Zurich.
Okay, why did you start medicine? What was your first move to enter this fantastic field?
So I was very young when I decided to start to study medicine. I think I was in middle school, and most of it I think comes from my father. He's also a doctor, and I remember in every car trip I would asking about diseases, about pathology, about how we get sick, why we get sick, and all of this. And I really remember, I think that's where it stemmed from. And also, I really remember reading all the leaflets from any medications we had at home.
That's interesting.
Weird. I was just very interested. And then I loved science at school, biology. And for me, I think it was pretty straightforward that I just wanted to become a doctor.
Yeah, also me, I started very young. I recently posted a reel. I said when I was 4, I wanted to become the Pope.
Yeah, I saw.
But then immediately I started, when I was, I think, 7 or 8, I decided to go into medicine. So we have the same path. And why plastic surgery? So, okay, medicine, I understand, but why plastic surgery?
That came after, meaning, as I mentioned, I wanted to become a general surgeon, and particularly I was interested in surgical oncology, which is cancer surgery, basically. So I did my medical school thesis on that topic, on pancreatic cancer. And then while during the training of general surgery, we had some combined cases with plastic surgery, so very big cases where we were removing the cancer and then the plastic surgeons were performing the reconstructive part. And I was thinking more and more that probably that was my real goal.
Passion.
My passion. And so it took a little bit because again I started a different training, but then by working with them, that's how it came.
Okay, and why? You said you started studying in Italy and then you decided to move to Switzerland, and then during your Swiss period you decide to also train a little bit in the US. tell us about this journey. Why?
So as soon as I decided to become a surgeon, that was more or less in the third year of medical school, I also decided to leave Italy for the training because I thought that it would be good to get an international type of training in surgery. And so I had a basis of German. So I had to restudy all German. That wasn't easy, I have to say. So that's why also I picked Switzerland. I had some colleagues that were there, were extremely happy of the training. And on top of that, when I was interested in general surgery, I did all my American exams. I did research so that I could get my CV oriented for the US. So I got accepted at this amazing general surgery program at Johns Hopkins, and I went there.
How long have you been there?
1 year.
1 year.
I did 1 year of training. It was a very tough training. I waking up at 4:30 in the morning, 6 days out of 7.
And you were telling me the other day that you did during COVID, right?
Yeah, I was there during COVID.
So you did also some COVID treatment in the ICU.
Yeah, basically my time in which I was supposed to go to the ICU, it was COVID. So it was a surgical ICU, but we also had the COVID patients. So we were like, and it was right at the beginning. So it wasn't very clear. I remember everyone in Italy was already in complete lockdown. We weren't in lockdown there yet, but we had a lot of patients. And I remember back there we had to wear like a complete cover of the head.
Yeah.
We didn't have the masks. They said they were not enough at the beginning. So it was like very difficult to go in, to go out. It took like 20 minutes. We had to disinfect everything in, disinfect everything out. It was...
Well, I think, of course, it was a tough period for everybody, but it was a great experience also for
definitely.
you. And
yeah,
I think the human part of it, to see this patient, and also the, professional one, because you think you learn a lot of other things and maybe in
otherwise
a normal,
I would have never,
exactly,
yeah, definitely. And especially as you mentioned, the human part, like dealing with the families, and it was different, I have to say. So as you mentioned, it really exposed me to something that I've never been exposed before, and probably and hopefully I won't have to deal with in the future. I hope that no more.
Everybody hopes that.
Yeah, exactly.
Of course, this was a big training for all of us in all the kind of lifestyle, etc. But so very interesting because you were able to test different kind of approaches to the medical field in general, from plastic surgery, but not only. And how did you hear about me? Why? I know, but our listeners, they don't know how we came in contact.
Yeah, that's actually quite interesting. And it's crazy how sometimes life just helps you out if you do what you like. I was doing a fellowship at the Akademikliniken in Stockholm. And I was telling to the colleagues there that I was interested in expanding my field. I was looking for new opportunities, basically. And one of the colleagues knew you, and he spoke highly about you. And he said that you were looking for someone, for another plastic surgeon to join your team. And so he gave me your number. He said he saw me working. He thought we could be a good match. And he was like, contact him. And that's how I started to talk to you.
Yeah, it was, I think, 1 year and a half ago when we first got in contact.
It was a while ago, yeah.
Because you were still in the residency, so we were discussing.
Yeah, and I had never thought of moving to Dubai, honestly. So that was also part of the decisional process.
Exactly, because, in Zurich, I think you had some opportunities already when you finished your residency to start working there.
Yeah.
And why the move to Dubai?
So, one of the main things is that I was looking for someone to work with that shared my same vision of plastic surgery. So that, I think, was the main thing. I wanted someone also, you're a great surgeon, you won prizes. So for me, that was also very important. But I had two things in mind. So not only surgically and having someone that shared my own vision, but also it had to be a very nice person. Because in this job, we basically, I cannot say it's a 24 hours job, but we are continuously in contact for the patients. We talk about the projects. So there's a lot going on. And because of this, I also wanted to make sure that it was a nice person I was going to work with. So someone humble, someone that was willing also to explain to me his tips and tricks, so that for me it could keep being a growing process.
Yeah, because maybe our listeners don't know that when we do residency, most of the time we just execute orders from older doctors. We do a lot of reconstructive because we do residency in big hospitals, so where the aesthetic part is not that present, and we don't have anybody who really there to teach us the aesthetic part. And also for me, when I was in residency, I was trying to look on different colleagues that were doing, something outside the hospital to go and steal their tip and tricks, understand how they were performing some procedures, and refine my skills, because the residency gives us a very good base. So we know the basic surgical skills and we can afford to do anything. Yeah. But at the end of the day, when it comes for aesthetic, and you're seeing these days more and more how different it is from the training that we received.
Yeah, and that's also why I did 2 fellowships specifically in aesthetic surgery, exactly because what you're saying, I wanted to expand that field more. So one was the Akademikliniken that I mentioned, and one was from the International Society of Plastic Surgery in Montreux, in La Clinique in Switzerland, and that really helped.
So you also speak, how many languages do you speak?
No, I speak 3. Italian, English and German, and I was learning French before coming here. Once I settle here, maybe I will get back to study French.
No, it's time for Arabic.
It's a beautiful language, but it looks so difficult.
I need to admit, after 12 years in Dubai, I still, knew only few words. And now I don't have the time to put myself down and to start doing that seriously. And Dubai is such an international city that, with English, you can really get along with all the patients, basically. And then we have our fantastic Sarah, if we need the translator.
Amazing Sarah.
Yeah, absolutely. Good. So what is, because you said, I wanted to find someone who has the same vision in plastic surgery. What is your vision of plastic surgery? What is, of course, is similar to mine, but tell us, what is your vision?
Well, the first thing, if I can say into basically a few words, is natural results. I'm really someone who wants to give to patients natural results. I think plastic surgery should make you enhance what you already have. It shouldn't change you. So I see more and more surgeons that like performing procedures that really change patients, and I don't necessarily agree with that. So if a patient has certain issues that they want to address, then that's where I would like to come into place. And I have the feeling that I had the feeling, because now I know you, but that you were sharing the same point of view. You are, for example, someone, and I very agree with that, it says no to patients. If you think that the procedure is not the right procedure, you say, I'm sorry, but then I'm not the right surgeon for you. And I really appreciate that, because I think it takes not only courage, but telling to someone I know this is what you would like, but I'm sorry, but I don't think that's what you actually really need. And
because also you drag yourself into problems, because the moment you understand that that's not what the patient needs or patient wants to achieve, because also we have a very big part of our job is psychology. We need to understand what the patient wants, why the patient approach us, what is the result that they're looking for. And that is very important to really communicate clearly with them and understand at a certain point, why do I have to put myself in a situation where I know that this patient will never be happy? Or this patient, I cannot deliver the result the patient is looking for, is in his mind. Most of the time now they look on Instagram models and said, I want this face, I want this body, I want to... Yeah, but your body is not like that. Yeah. We can do something on your body to enhance, as you said, very, very good, but not to really change you completely. Unless there is a reason behind that, exactly. Which is, another big topic. We're not touching it today. Exactly. So, and what do you like about plastic surgery? Because you said, you were encountering plastic surgery during your general surgery period.
Yeah.
What do you like?
That's a very good question. I think the thing that's for me was the most fascinating is that plastic surgery, I think it's the surgical specialty where the uniqueness of patients is the most important thing, because the procedures in many other surgical specialties are pretty standardized. Of course, every patient is different. Of course, the anatomy is very different among patients, but still, they are pretty standardized. If you take in plastic surgery, every nose is different, every eye is different, every breast, even the asymmetries, every patient, no one has the same breasts. So I really like the fact that I could put a little bit more, if I can say this, of my input on that, because every for example, if we take breasts, every surgeon would get a different result, or similar but still not the same. And that is because you put your own idea into it, your own perspective, your own experience. Absolutely. So, and that was the thing. And I really like art, and I like beauty, I like harmony. And so putting all these things together, I really thought that's why plastic surgery.
Because we always say, plastic surgery is a combination of science and art.
Yeah.
And if you don't have an artistic eye, artistic taste, and we are lucky because we are Italian, we have this, centuries of background of history and art and culture that really help us. And you can see in fashion, for example, the hub of fashion is Italy. Art, a lot of painters. I was listening to a podcast recently, and they were saying that if you look at the South America, the Asia part, etc., they don't have face painting. They don't do painting of the face of people because it's not in their culture. How many we have from Leonardo, from Michelangelo, all of them, they really focus on the face. So I think our blood is filled with this, passion and this push towards the beauty and the art. So I think we are lucky in this sense. We were born much in the right part.
Very proud to be Italian. Despite I left Italy, I'm very, very proud of
me
being
too.
Italian.
We miss Italy a lot. We know that. We always say. And so you said every patient is unique.
Yeah.
How do you tailor your approach for each patient?
Two main things. Observing them a lot. So from when the patient walks in the room, I start to look at how they move their face, which, for example, expressions they perform. So these things, and talking to them and trying to understand what they want. Because sometimes what I think is what I would do to help them, let's say, it's not necessarily what they're looking for. Sometimes I feel like they need something and then they walk in and they tell me that they want, I'm here for something completely different. So, of course, listening a lot to them and then, as you said, putting your experience. And I think what really helped is, for me at least, working with many different surgeons from many different countries, different fellowships, different trainings. So I saw a lot of different approaches, and I feel like that really helps because then you can use different techniques and different subtle changes according to the patient you have in front of you.
And you have to create your own approach. So you have seen most of the time my approach is almost the same. Then, of course, understanding the patient I have in front of me and tailoring the procedure and the approach. But the explanation I give is like a broken disc for me, all the time. I say the same thing because it is proven to me that in this way I can deliver all the messages I want to deliver to the patient in terms of possible outcome, possible complication, recovery period, surgical time, etc. The patient knows exactly what they are, what is waiting for them. And this helped me to create my own approach that I think you're seeing now, you are absorbing it, and I hope in the future you will deliver your own, because you don't have to be the copy of myself or copy of anybody. You are unique. As the patient is unique, we are unique, and we need to have our own approach. So I hope that this period with me will help you to really discover what is the best approach to the patients. Because at the end, again, when you have the basis, and we have the basis, it's just a matter of how you put this basis together to deliver the service you are.
Absolutely.
So you said that you went to different Akademikliniken, you went to Montreux. What did you like about all this experience? What bring you? What can you bring to yourself with yourself for the future?
Yeah, as I was mentioning, I think for me it was mostly working with many different surgeons because all these institutions are very big. So you have many different operatory rooms working the entire day, and in each of them there is a different surgeon, so you get to move around and work with different surgeons. So you see how different they are, how different they approach things, how differently they pick breast implants, for example, and all of this. So I think that this experience, in the end, they really exposed me to seeing a lot of different things. And I think in our job especially, you never stop learning. Like, I think it's a job where you, even 10 years from now, I will keep going around working with, like, observing also other surgeons. It's very typical for us to ask two colleagues that are very good in one specific procedure if you can go 3 days and observe how they do it. Because things keep changing. There are new techniques coming out, and that is very important. You cannot just learn one way and keep doing it for the rest of your life, because, as I said, approaches changes. You change with experience. Your approach to the surgery changes. So it's always very important to.
But also, it's very
learning.
important what I like also about my training. I was trained in Brazil. I went to Ireland. You see different cultures.
Yeah.
So you've seen Sweden, you've seen Switzerland, you've seen France, you've seen Italy, US, and this really widen your horizons, and you can really appreciate, especially in a city like Dubai, where we have, multicultural patients from all the parts of the world, and you can really understand what they're looking for. And this is also, very good for me to have chosen someone who can have this kind of international approach, because I've interviewed, of course, different people before you, and everybody was just in their own country in Italy, their own city in Italy. They were doing the training there, never took a chance to go and see outside. Of course, they didn't speak English. Some of them, they would say, my English is not very good. I said, I'm sorry, you cannot work in Dubai if you don't know English. So that is also for me to find someone who I can trust and rely on, because you at this stage, of course, you need to be known in Dubai to create your own patient database and pool. At this moment, you're working with my patient, so I need to trust you, and I know that I can leave the patient in safe hands, not somebody. What is she doing? And this, open vision. It's something that it's really, really important for me, definitely.
Yeah, and definitely, as you mentioned, it's very interesting to see how the patients, according to which country they're coming from, their expectations.
Oh, yeah.
In a way, they're similar. Like, Italians like one thing, South Americans like another thing. It's very interesting.
And also the idea of beauty
is different.
It's completely different.
Yes.
When I first moved to Dubai, I remember that the first patient I did a surgery that for me was perfect, beautiful, and an Italian patient would have loved it. She said, I'm not happy. Because the idea of beauty is completely different.
Yeah.
And you need to really adapt and focus on really the background of the patient, the cultural heritage that they have, and the idea of beauty that they want to deliver themselves. So I think Dubai is a very big pot of all these things. And what do you think about Dubai? First of all, when I reach out to you, or you reach out to me actually, what did you think about Dubai? You've never been to Dubai when you called me. So what is your impression in Dubai?
Well, I have to admit, at the beginning, again, I didn't know Dubai. So, and I was happy where I was in Switzerland. So at the beginning, I was a bit unsure about the city, never about you, but about the city, because again, it was unknown. So before making the big decision, I remember telling you, okay, I'm going to come on vacation, and so that we can meet each other, I wanted to observe also how you work and how you work with patients, how you operate, and then seeing the city. And I really liked it. The first impression was very good. Very big, very different from Switzerland, very international.
As clean as Switzerland, as safe as Switzerland, but maybe even safer, but definitely.
Safer. I mean, Switzerland is a very safe country,
yeah.
But here is like next level. Here you can really leave your purse, your phone, like no one is going to I love this. It gives me a very nice feeling. It's very nice. And so it's very international. There is a lot of competition, plastic surgery-wise, which I think is good, because it keeps you keep to have innovating, and you need to stay up to date with everything.
Definitely.
But that was another thing important for me. You've been here for a very long time. So you have your own patients, a lot of patients. They know you. And that was also very important for me, to join a team of someone that already had a good, very strong basis as you have here.
Yeah, because again, because there is a lot of competition, there are a lot of doctors, and most of them are coming now. We see a lot of influx of new plastic surgeons, but And the patients are increasing because a lot of newcomers are arriving in Dubai to live here. So the population is growing as well. And there is, food for everybody. There is patients for everybody. But I see a lot of colleagues struggling to get enough patients to keep the practice going.
Yeah.
You need to have a certain number of surgeries per year. You need to see a certain number of patients, because this also is like when you do something regularly, you keep doing it in a proper way. When you do something every so often, then maybe your skills lose a little bit of touch, and it's very important. So the fact that you decide to come with me because you saw that I was busy is very important, because we don't have a dull day until you came. Sometimes, and I told her, it's different from the hospital life, which is very busy, very stressful, but the aesthetic practice is completely, you have to be all in, you need to be completely. Sometimes, we text each other at 11 o'clock in the evening for a project, the patient tomorrow, have you seen these little details that we might change the surgical plan, because it's a never stopping work, which is what I like. My brain is racing all the time, and I'm sleeping, but my brain doesn't. So, but I hope also to transmit to you this, that it's not the 9-to-5 job. It's something that goes beyond, and because it's a passion, they say find the job that you love, you never work one day in your life. We are working, and sometimes it's hard. It's physically tiring, psychologically tiring. When yesterday, I think we did like 8-9 hours of consultation the whole day. You are tired at the end because your brain is really tired. But at the end, you go home and said, I'm satisfied with what I've done. There is always something to learn, and that's the beauty of things.
Yeah.
So just to tell to our listener, what is your role now with me and my team? Because they know me, they know Sarah, they know how we work, and seeing somebody new for some patients is a little bit, disrupting their routine. So let them explain why you're here, what is your role in my team.
So I am operating with you, and I'm seeing all the patients with you preparatively. So I'm also seeing how you do your visits. And then I take care of the patients in the follow-up. And I'm also taking over the aesthetic medicine part, because you don't have time anymore for it. And slowly, as soon as I get my patients and they start to trust me and know me, I will also be performing the aesthetic surgery procedures.
Okay, so now if you come and see me, you will see her next to me in the consultation room. And then you will see her the day of the surgery. She will be the one who will approach you after the surgery if there is any problem. She will see you for the change of dressing, but also the aesthetic part, as you said, because my practice is growing. I always love to do aesthetic medicine, but it takes me a lot of time, and she has a good hand in that. She's a great surgeon, but also she has a good hand in aesthetic medicine. So I'm trying to divert the patient towards her, because again, we share the same vision, the same approach to the aesthetic medicine, something natural, something subtle, something that really enhances the beauty of the patient without transforming them. And in this way, she can really be your new point of trust for my patients. And I have a lot of patients comes, I want you because I trust you. And we are trying to deliver this message that if you trust me, you can trust her, because she knows exactly what I want, and I have selected you for the reason we said before.
Yeah.
So that's very important. Okay, so I think we covered all the professional part, but our life is not only job. It's not only work, there is also something else. What do you like to do in your free time? What are your passions? What are you exploring to do in Dubai now that you just came?
So I am a very outdoorsy person. I love nature very much. I love sports. So in my free time, that's what I do mostly. I have to reassess everything now here in Dubai, because in Switzerland there was a lot of skiing, ski touring.
We have Ski Dubai. You can go there.
I still didn't try it. A lot of hiking in the summer. So I will still have to, now I'm going to the gym basically. I was doing a bit of gym before, but integrating mostly with other sports, play tennis. And my big dream is going back to golf. I actually went to see the golf court here. It's very, very beautiful. So slowly I will find my way through new sports here. Tennis I already picked up. And and then I know you have mountains around here. So I still have to explore.
Beautiful rock mountains, but they're beautiful. And the climbing and the hiking there is really, really nice. And the views sometimes are breathtaking.
Yep, so I still have to explore that.
Yeah, you have time. Just a rush, so for sure. What is one thing that people don't know about you or will be surprised to learn about you?
Professionally or
both?
Professionally, actually, the first time I was in a surgical room, I fainted 3 times.
Oh, wow. I didn't know that.
So I think I always knew, once I decided for medicine, I always kind of knew I wanted to become a surgeon. I haven't been in a surgical room yet, but the idea of moving my hands already made me think that that's what I wanted to do. So in my 3rd year, I decided, okay, let's go into a surgical room and see how it actually is. And I don't know, I think I was so excited. Too many things going on, fainted once, go out, take up a breath of fresh air. And then I'm like, no, I was totally fine. So go back in, 2nd time. I mean, 3 times. There was a colleague of mine that kept like holding me every time. And people were like, are you sure this is what you actually want to do?
I remember when, sorry to interrupt you, when I went the first time, I was in the 2nd year of medicine. The surgeons outside the theater said, okay, guys, just one rule. If you have to faint backwards, not forwards.
Yeah, exactly. So actually what happened is that then another time they gave me the possibility to scrub in. So actually, because when I fainted, I wasn't scrubbed in. I was just observing. So they asked me if I wanted to scrub in, and I was dying. I was like, of course. But at the same time, I was very scared. I said, I already fainted last time. So I didn't feel like scrubbing in the next time after this 3 times fainting, because I was afraid of fainting in front of the sterile patient. So I said no, and I observed again. That time everything went well, and then thereafter I could scrub in.
Okay, this is professional. This is your secret of fainting in the theater. What is in the private life that something that is interesting about you?
I don't know if it's interesting, but I really love animals very much. Always loved them, like since ever. And my biggest dream that has not been fulfilled yet is getting a dog. So I'm really hoping somehow, it's just that with our job, it's basically impossible.
I had a job which unfortunately she died during COVID, not for COVID, but she was very old. And I would love to have another one, but how can we do that?
Exactly. And it's like, because I love them so much, I want also to make sure that they can live a very nice life. And at the moment with our working schedule, it doesn't work out. But that is like my big dream.
I'm sure, yes. Also, I have a plan. My retirement will be in a big farm with a lot of, animals, especially dogs. I love dogs as well. So, it could be a nice way to retire with them.
Yeah.
As plastic surgeon, we face a lot of false myths and misconceptions around our job and around the beauty standards. What is the biggest one that you want to debunk a little bit?
Patients are so scared in general. So many times I hear, oh, doctor, it was great. I wish I did this before. And it's a bit of a shame because sometimes patients decide to go for just aesthetic medicine because they're very scared of the surgery. And nowadays, most of the surgical procedures we perform can be done in local anesthesia and sedation. So there is no general anesthesia, no intubation. Our anesthesiologist is amazing. So after surgery, they can walk. Most of the time, they ask me how many days I will be in bed. It's like bed, couple of hours after surgery. You need to be up and about. You need to move. That helps the recovery. So this, I think, is probably the biggest misconception I've been noticing.
Yeah, it's important that, again, we guide the patient. Also, always tell them, I have a big belief that the shorter is the procedure, And not because we are fast and we are less precise, but just because the less we traumatize the tissue and the faster the recovery.
Yeah.
So it's very important that they understand this, and giving them I recently heard that this doctor taking 4 hours to do a blepharoplasty. And to me is absolutely unacceptable.
Yeah.
Not because you can be a little bit slower, you can take your time, want to be more precise, fine. But 4 hours for this kind of procedure, I can imagine only the recovery of this patient will be forever. So that is very important that we deliver this message to the patient. Choose your doctor right, because you need to see the before and after, and also understand that if it tells you that the recovery is so quick, there should be a reason, okay? And we're not lying. And the patient are testimonial, they say, oh my God, I was so back to my life in no time, and I'm so happy for that.
Yeah.
And what is a suggestion you can give to the young colleagues that start approaching the plastic surgery and the training and the residency and then their future career?
Like in general, I would say to whoever wants to become a surgeon, just do it if you really have a passion for it, and for no other reason, because it's a very tough life. And it becomes, you always think that it will get a bit better. It doesn't. For different reasons. But surgical training is very tough. Like it's 6 years that are very demanding. And thereafter, as we mentioned, like there is, you have to keep changing, keep growing. You face different issues. You need to move from hospitals, and then you start in the private practice. You face the issues, quote unquote, of the private practice. So there is so many things going on in general. And I think if you don't do it with passion, you just do it because you think it's socially accepted as a very nice job or for the money, I think it doesn't work.
No, definitely. There should be a really big why behind this, why you want to do it, and the passion that you put into it. Because you said, you could think, okay, Dr. Vigo already achieved, a very good position in his job. Is done. You just keep doing these things. No, there is every day new challenge, a new project. Again, I put myself into this. Problem.
Not everyone does what you like do.
But I like to really change every day the approach, every day something, improve this, improve that, and also because now I'm growing the team. I like to give you my vision, give you and Sarah to see, and Sarah is with me 7 years now, and she has already my vision completely. You are still new and you are learning this, but I hope to transmit to this that it's not only the surgical part, which is our favorite part. We love to be in the theater and this is what we love. But there is so much around it that we can make really a difference in a personal life and in our life. And we can choose the way we want to live our job and to live our life. That is, I think, the most powerful message in a team, as a team leader, that we need to do that. So work harder, because nothing comes if you don't work hard. But at the same time, appreciate all this kind of little inputs that comes from a patient, from a colleague, from a nurse, from anybody else, and put them together to create your own way of working. Then you can work 1 day per week because it's what you want to do. It's your choice, but at least you have tried everything and you create your own vision. So thank you so much for being here.
Thank you for having me.
Thank you for joining me in Dubai, leaving Switzerland, and the boyfriend. She left her boyfriend in Switzerland.
Yeah, I did.
But I hope you enjoyed this episode. I hope you will see her face more and more. You start trusting her, because I trusted her. So if you trust me, you can trust her as well. She's a great addition to my team, and she will really make a difference in the workflow for us. So stay tuned. You will see her more and more on my Instagram. We'll try to interact a little bit more and give some nice information about her, about the treatment she's offering, and slowly you will grow your own practice inside my team, and you will fly with your wings.
Thank you.
Thank you so much. If you like the episode, please subscribe and put a like, and stay tuned, because more and more episodes are coming on the way. See you. Because you deserve the best.